Sometimes for me, I used to talk about the list. It was kind of like, well, I have this, I have this, I have this, I have this. I had needed a couple of hands to tell you all of the things that I had. And honestly, it's response to complex trauma as a child, and all of the ways of coping, right? Those unhealthy ways of coping that started out not necessarily unhealthy, but certainly became that way.
The diagnoses that challenged our family the most was definitely my brother's bipolar and ADHD. There was also my father's PTSD. When he got back from the war, he was not the same person. He didn't have the same personality. He wouldn't sleep at night. He was like, you had to interact with him differently. He would startle easy. It was challenging because, when he left, he wasn't like that. He was very funny and, just didn't have all these challenges. And me and my brother were young, and when he first left for the war, I was 7. I didn't even really understand what was going on and what he was over there doing. So learning more and more about it as he got back, and we had to deal with his new little quirks and personality changes and anger. It also was very challenging with my brother because you never knew what to expect. It was, he would be manic sometimes, he would be depressed sometimes, and if he was manic, it was everybody else's issue. If he was depressed, it was everybody else's issue. He would, camp out in the living room for weeks at a time, and so you can't go in the living room anymore, and you kind of have to adjust your life around what's Corey going through right now. And then there's the anger of why can't he handle his own life and I have to handle mine? And I found that very challenging.
I think the most challenging mental health disorders to deal with are the ones that aren't being treated. When whoever's experiencing symptoms or a crisis isn't getting some kind of outside help or support, it falls more on the family and the people that love them to try to manage. And it's really not something you can't, I can't manage someone else's mental health. I can want them to be better. I can encourage them to be better. I can show them how I've gotten better and the things that I've had to do, but I can't make them get better. And that's a really hard thing. It's a really hard thing to come to terms with.
I do feel like we're moving in the right direction. There's a lot more talk about it. When I was younger, you didn't really talk about depression and anxiety and ADHD and stuff like that. You were seen as a problem, especially with my dad being in the military and law enforcement. It's you can't, or at least back then you couldn't, because then they wouldn't let you do your job anymore if you admitted that you were having psychological issues, even if they were stemming from the war, which is a very real thing. People need help after that, but if you try to go get help, then you get stigmatized. And I think my brother, seeing my father do that type of stuff, he thought, well, this is how men act with mental health. Stuff it down, rub some dirt in it, and deal with it yourself. And you can't deal with those things by yourself. You need help. And there's much more understanding of it now, which I think is the first step.
I feel like for me, and I think most other people, that substance use disorder has to be dealt with first. Because otherwise there can be no stability or ability or foundation to deal with all of the other things. Although I know sometimes it can be helpful for people to find somebody that they trust and to get into a good therapeutic relationship while they're still using substances, and can make headway or get help in that way also. I'd like to see society continue to talk about mental health in really clear ways with each other, about what we experience individually, what our family members experience, and really what that looks like in each family. Because I think people that don't know terms or don't have training or knowledge or have never been to therapy may not understand what they're seeing in their own family. So the more we talk about things in plain language that everyone can understand, someone might be able to identify and get help for themselves, or point a family member in the right direction.